we will be starting with removable partial dentures. In RPD, there are about 65,000 combination possible of missing teeth and edentulous arches. To put all of these different missing combinations into place, we need something which is called as a classification. So there are several classifications of RPD, and the most commonly used classification in partial dentures is called as your Kennedy's classification, given by Edward Kennedy in the year 1923. That is your Kennedy's classification. Now, why do we need a classification? The first step or the first reason why we need a classification is to create a workable order. What do we mean by workable order? When you see a particular scenario in a patient's mouth and you want to describe it or you want to put it down into a piece of paper, you need some sort of nomenclature. That is called as putting things into a nomenclature or a workable order. So that is the first requirement of having a classification. Second requirement is to have effective interpersonal communication. Now, what do we mean by interpersonal communication? Is that, say, I am a clinician observing my patient right now, and if I want to discuss the case with another clinician, then how do I convey what is the scenario in the patient's mouth? So for that particular reason, we need interpersonal communication. We need our classification. So that is the second reason. Third is to put it down into your case history. So for record purposes, when you observe or when you examine a patient and you want to put down the patient's clinical scenario or what is the condition in the patient's mouth into a case paper, you need a particular nomenclature system. So these are the three main reasons why we need a classification. Now, as I said, the most commonly used classification is your Kennedy's classification. It was given by Edward Kennedy in the year 1923. So we will start seeing the different classes of Kennedy's classification. There are mainly 4 classes that are there primarily to classify the different arches. Class 1 would be a bilateral edentulous area. As you can see in the photo here, you have a bilateral edentulous area with missing teeth that are posterior to natural teeth. So we can very well see and appreciate it in the picture here. As you can see, there is a bilateral edentulous area. That means teeth are missing on both sides of the arches. Natural teeth are located anteriorly in this region. So bilateral edentulous area with missing teeth located posterior to your remaining natural teeth, that forms your Kennedy's class 1. Coming to Kennedy's class 2, you have a unilateral edentulous area. So the area here is a unilateral area, again located posterior to remaining natural teeth. That is the second criterion. The unilateral edentulous area located posterior to remaining natural teeth. That is your Kennedy's class 2 situation. What is Kennedy's class 3 situation? Is a single unilateral. We have a single unilateral edentulous area with now natural teeth located both anterior. Natural teeth are located anterior and posterior to it. So natural teeth located both anteriorly here and posteriorly, and they are binding the edentulous area. That is called as a Kennedy's class 3. Kennedy's class 4 would be what? A single edentulous area which crosses the midline. Now, if you see previously, Kennedy class 3 did not cross the midline. Here, Kennedy class 4 is crossing the midline and natural teeth are located posterior to the edentulous area. So, natural teeth posterior to edentulous area. This comprises Kennedy class 4. So there are mainly 4 different classes of Kennedy. Then there are several modifications that have also been given. But for our learning purposes, we'll just keep these 4 Kennedy classification in mind. You need to practice Kennedy classification very much because it is the essence or foundation of your entire learning of partial dentures. Now, there were certain set of rules that were given to understand or apply the Kennedy classification. These rules, what were they called? They were called as Applegate Rules. So what are these rules? Applegate Rules are a set of rules that are used to apply the Kennedy classification to an partially edentulous condition. They are basically a set of guidelines that have been given to apply this particular or use this particular classification. So what are Applegate Rules? The first rule says that extraction should follow any classification rather than preceding the classification. So extraction should always follow any classification rather than preceding the classification. I'll help you understand that with the help of an example. As we can see in the first photo over here, these particular teeth are indicated for extraction. Now, if we classify this particular edentulous arch before the extraction, it becomes a Kennedy class 3 situation. Why? Because it is bound by natural teeth located anteriorly and posteriorly to it. But once we do the extraction and then we rehabilitate your patient, then the classification becomes a Kennedy class 2 modification space 1, right? So the classification changes after extraction. That is why it is always advisable to do the classification after any necessary extraction is done. That is the first rule of your Applegate's classification. Second rule says what? Second rule says that if a third molar is missing and it is not to be replaced, then you do not consider it in the classification. So as we can see in the picture here, this third molar is missing, but we do not replace it, or we are not intending to replace that third molar. We do not consider it into the classification. Similarly, our third Applegate rule, it says that if a third molar is present and we are going to use it as what? An abutment teeth. If you are going to use it as an abutment teeth, then you consider it in your classification. Then you would 100% consider it in your classification. So that is how it goes. If your third molar is missing and not to be replaced, do not consider it into the classification according to Applegate rule number 2. But if your third molar is absent, or rather, third molar is to be used as an abutment, then we consider it in your classification. Rule number 4 is pertaining to your second molar. What does it say? If the second molar is missing and the opposing antagonist is also missing and it is not to be replaced, then we do not consider it into the classification. You can completely avoid it. You do not consider it into the classification. That is the rule number 4. Rule number 5 says that the most posterior edentulous space will govern the classification. So whichever set of missing teeth which are located more posteriorly, that governs the classification. So you can see over here, see this particular scenario, see these teeth are missing into the patient's mouth and this teeth are also missing into the patient's mouth. Then this particular set of missing teeth or this particular span of missing teeth will govern the classification or will decide the primary classification under the Kennedy section, right? So that is your rule number 5. Rule number 6 is that any other edentulous span apart from the one governing the classification, is called as modification space. It is called as modification space. So let me take this particular example here. You have these teeth which are grayed out. Suppose they are missing, right? Out of this, if we systematically go, this is the set of edentulous span that is located more posteriorly. So that is going to govern the classification. So this becomes a Kennedy class 2. And then the other classification will be this particular space which is missing. It is termed as a modification space. That is according to rule number 6. What does rule number 7 say? That you just see the edentulous spaces, right? You do not see the number of missing teeth when counting the modification space. So only the number of edentulous span or edentulous space are taken into consideration. Number of missing teeth are not counted when giving the nomenclature of modification space. Let me take an example here again. This was the particular edentulous span that was governing the classification and we called it Kennedy class 2. Now if you can see here, 2 teeth are missing, but we will name it as just one modification space and not 2 in number, considering the number of missing teeth. Similarly, supposedly if this particular tooth was also missing here and this section was also missing over here, then our classification becomes Kennedy class 2 modification space 2, considering that there are 2 additional edentulous spaces. So what rule number 7 tries to say is that consider the number of edentulous spaces only. Don't give importance to the number of missing teeth in the edentulous spaces. That is rule number 7. Rule number 8 is a very obvious rule which says that there cannot be any modification space in Kennedy class 4. So there cannot be any modification space in what? In Kennedy class 4 situation. The reason is what? Kennedy class 4 is located anterior to remaining natural teeth. If there was any edentulous space, it will be located posterior to it. And according to rule number 5, then it will govern the classification and the classification shifts from a Kennedy class 4 to the other classification. That is why we can never have any modification space in Kennedy class 4. So overall, this is your introduction and classification of partial dentures, and we have seen Kennedy's classification, we have seen Applegate's rules. They are thoroughly very important to understand partial dentures and to understand the different components of partial dentures. We can discuss the different examples now to understand the Kennedy classification in details. I have taken this particular photo from McCracken's. As we can see here, there are bilateral edentulous spaces located posterior to remaining natural teeth. So this becomes a Kennedy class 1 situation. There is a unilateral edentulous area that is located posterior to remaining natural teeth. So this becomes a Kennedy class 2 situation. Now from here, this has started to turn interesting. This is one edentulous area, this is another edentulous area, this is one edentulous area, and this is another edentulous area. As we can see, these are the most posterior edentulous area. So according to Applegate rule number 5, this is Kennedy's class 1. Apart from that, we see 2 edentulous spaces. So it becomes modification space 2. So from here, we can take into consideration that this is Kennedy class 1, modification spaces 2. Coming to the next example here, there is a unilateral edentulous area. Now, third molar, I suppose, is missing here, but we will not be replacing it, so we are not taking it into consideration. So I say there is a unilateral edentulous area that makes it a Kennedy class 2, and I see one more edentulous space here, so that is why we make it a Kennedy class 2, modification space 1. So here, as you can see, this is class 2, modification space 1. Taking other examples into consideration, there is only one edentulous area here with natural teeth located anteriorly and posteriorly to it. It is a very simple, straightforward classification. This is Kennedy's class 3. Coming here again, a longer edentulous span. This is also possible in Kennedy's class 3, that you can have a long edentulous span also, but it is bound by natural teeth anteriorly and posteriorly. So this is a definite Kennedy class 3. Coming to this particular set now, I see one edentulous space here. I see one space here. This one is the most posterior one. This is bound by natural teeth located anteriorly and posterior to it. So it becomes Kennedy class 3. And we have one more edentulous space. So it becomes Kennedy class 3 modification space 1. Now you can see here the edentulous space is located anterior to remaining natural teeth. Straightforward, it becomes Kennedy class 4. It's a very simple classification to understand. With a little bit of practice, you can get a hang of it. Class 3, because of this posterior space, and then this is the modification space. Now this is a very good example to understand the last rule of your Applegate classification. The rule says that there cannot be any edentulous spaces in. The next scenario here is a missing area located in this region and a missing span located anteriorly. According to Applegate's rule, this will determine the classification. Hence, this becomes Kennedy class 3, and we have one more edentulous span, so it becomes modification space 1. So this is class 3, modification space 1. Now, coming to slightly complex examples here. Bilaterally missing area and another missing area anteriorly. Do not get confused here. This is Kennedy class 1 because of the bilateral missing areas, and there is one more additional missing area anteriorly. So it becomes modification space 1. The next set that we can see over here, there is a unilateral edentulous area located posterior to remaining natural teeth and two additional areas, which will make it Kennedy class 2 modification space 1. Now you see an entire edentulous area on one side of the arch. This is slightly debatable, but we call it Kennedy class 2. And lastly, you can see this particular edentulous area that is even crossing the midline, and you see two other additional edentulous area. Some may even want to call it a Kennedy class 4 because it crosses the midline, but technically, according to Applegate rules, that is going to be wrong, because then the most posterior edentulous space is here, which will govern the classification. So according to Applegate's rule and a bit modification here, we would call it Kennedy class 2 modification spaces 2 because of these two spaces. The point here that we want to consider is that Kennedy's classification universally cannot be applied to all situations. It is just not possible that a single classification can be applied to all situations. There are possible limitations of any classifications. This is one such example, but out of this entire picture that I've taken from your textbook McCracken only, this last example that we just discussed over here, I would consider it a very good question for your exam, because many students can make a mistake over here. So do practice all of this, and we go on to the next section of this particular chapter now, which is called as parts of RPD. So removable partial denture or a cast partial denture mainly has, if I want to classify, has two parts, a metallic part and an acrylic part. If you look at the metallic part here, this entire structure that is running, coming to parts of RPD or cast partial denture, if I have to classify, there are mainly two parts of a cast partial denture. You can just call it the acrylic component and the metallic component. Coming to the metallic component of a cast partial denture, this structure that is running at the bottom that you can see here labeled number 1, we call it the major connector. If I have to briefly tell you what major connector means, it is that component of a partial denture to which all other components are united. That is why it is called as a connector. These other smaller components that you see, this component over here, this component over here, fine, this one particular component over here, these are all components, even this, these are all components that are called as minor connectors. Minor connector are another set of connector components smaller than your major connector, which will unite different smaller parts of a cast partial denture back to the major connector. So since their role is unification, that is why they are called as minor connectors. There are about 3 to 4 different varieties of minor connectors, which we'll further discuss in the upcoming chapters. Now, this part 3, which you see labeled over here, this is called as an occlusal rest. An occlusal rest is a part of the framework, and together, if you can see it, with this entire assembly, it can be called as clasps or a direct retainer assembly. This is also a direct retainer assembly here. Fine. This here is also a direct retainer assembly. Then this part over here is also a minor connector, but this minor connector unites with the denture base. So that is a separate variety of minor connector which unites with the denture base. So in totality, this is what is forming the framework of the cast partial denture. Now, the cast partial denture that we actually give to the patient has this acrylic component also. So this here is called as the denture base, and these are called as the artificial teeth. They can be made of acrylic, they can be made of composite, or they can be even made of porcelain. So in totality, if we see, there are several components of a cast partial denture which are part of the framework and which are a part of the completed cast partial denture that we deliver to our patients. Individually, these components are very important for your cast partial denture to have a better understanding and design the cast partial denture. Individually, all of these components have a particular set of requirements which are supposed to be fulfilled to effectively deliver a cast partial denture.